When it comes to testing for migraines, the selection of laboratory or imaging studies is determined by the individual presentation. For instance, erythrocyte sedimentation rate and C-reactive protein levels may be used to exclude temporal or giant cell arteritis. However, it's important to note that neuroimaging isn't necessary for patients with a history of recurrent migraines and a normal neurologic examination. The American Headache Society has listed 5 commonly performed tests or procedures that aren't always necessary in treating migraines. These include performing neuroimaging studies in patients with stable headaches that meet criteria for migraines, performing CT imaging for headache when MRI is available except in emergencies, recommending surgical deactivation of migraine trigger points outside of clinical trials, prescribing opioid or butyl-containing medications as first-line treatment for recurring headache disorders, and recommending prolonged or frequent use of over-the-counter pain medications for headaches. Turning to the management of migraines, the pharmacologic agents used can be classified as abortive, for alleviating the acute phase, or prophylactic for prevention. Abortive medications aim to reverse or at least stop the progression of a headache. They're most effective when given within 15 minutes of pain onset and when pain is mild. Some of these include triptans, D-tans, CGRP receptor antagonists, ergot, alkaloids, analgesics, NSAIDs, combination products, and antiemetics. On the other hand, prophylactic medications are used when the frequency of migraine attacks is greater than 2 per month, the duration of individual attacks is longer than 24 hours, the headaches cause major disruptions in the patient's lifestyle, abortive therapy fails or is overused, symptomatic medications are contraindicated or ineffective, there's use of abortive medications more than twice a week, or there are migraine variants such as hemiplegic migraine or rare headache attacks producing profound disruption or risk of permanent neurologic injury. These include anti-epileptic drugs, beta blockers, tricyclic antidepressants, calcium channel blockers, SSRIs, NSAIDs, serotonin antagonists, botulinum toxin, and CGRP inhibitors. Apart from these pharmacologic agents, treatment of migraines may also include reduction of migraine triggers such as lack of sleep, fatigue, stress, and certain foods, non-pharmacologic therapy like biofeedback and cognitive behavioral therapy, and integrative medicine options like butterbur, riboflavin, magnesium, feverfew, and coenzyme Q10. To wrap up, migraine testing and management is a comprehensive process that involves careful assessment of the individual's presentation, judicious use of tests and procedures, and a combination of abortive and prophylactic medications, along with lifestyle modifications, non-pharmacologic therapy, and integrative medicine. It's a journey towards better understanding and managing this complex and often debilitating condition,